Which imaging modality is most commonly used at the bedside to confirm the correct positioning of the ECMO cannula tips? A. Chest X-ray and ultrasound/echo. B. MRI. C. PET scan. D. Fluoroscopy. Answer: A. Chest X-ray and ultrasound/echo. Explanation: Transthoracic or transesophageal echocardiography, TTE/TE, is the gold standard for real-time placement, while X-rays provide a quick daily check of the cannula's relationship to anatomical landmarks like the carina or diaphragm. A dual-lumen cannula, e.g., Avalon, is most frequently used for which type of ECMO? A. Peripheral VA ECMO. B. Central VA ECMO. C. VV-ECMO via the internal jugular vein. D. Femoral VV-ECMO. Answer: C. VV-ECMO via the internal jugular vein. Explanation: Dual-lumen cannulae allow for both drainage and return through a single insertion site in the neck, significantly improving patient mobility and reducing the risk of recirculation if positioned correctly. If an ECMO patient experiences a cardiac arrest, VF/VT, while on VA ECMO, what is the priority? A. Immediate chest compressions. B. Increasing ECMO flow and addressing the underlying cause. C. Turning off the ECMO pump. D. Immediate decannulation. Answer: B. Increasing ECMO flow and addressing the underlying cause. Explanation: Since VA ECMO provides full circulatory support, the machine is the heart. While defibrillation is necessary, chest compressions may be less critical if ECMO flows are adequate, and they carry a risk of cannula displacement. What is the significance of pink frothy sputum in a patient on VA ECMO? A. It is a normal side effect of heparin. B. It indicates acute pulmonary edema due to LV distension. C. It shows the lungs are recovering. D. It is a sign of oxygenator failure. Answer: B. It indicates acute pulmonary edema due to LV distension. Explanation: If the left ventricle, LV, cannot overcome the afterload of the VA ECMO flow, blood backs up into the lungs, leading to flash pulmonary edema. During VV ECMO, if the premembrane pressure is very high but the postmembrane pressure is low, where is the problem? A. In the patient's heart. B. Inside the oxygenator. C. In the return cannula. D. In the blender. Answer: B. Inside the oxygenator. Explanation: A large pressure drop, high delta P, across the oxygenator indicates internal resistance, almost always due to blood clots or fibrin deposition within the membrane fibers. Which size of cannula is typically selected for drainage in an adult ECMO patient? A. 10 to 12 French. B. 15 to 17 French. C. 21 to 25 French. D. 30 to 35 French. Answer: C. 21 to 25 French. Explanation: Drainage cannulae need to be large to facilitate high flow rates, 4 to 6 liters per minute, without creating excessive negative pressure, which would cause hemolysis. Seeding the oxygenator refers to: A. Adding antibiotics to the membrane. B. The initial process of filling the circuit with prime solution/blood. C. The growth of bacteria on the membrane surface. D. Replacing the oxygenator mid-run. Answer: B. The initial process of filling the circuit with prime solution/blood. Explanation: Also known as priming, this ensures all air is removed from the circuit before it is connected to the patient's circulation. What is the pigtail or side port on an ECMO circuit often used for? A. Drawing blood samples or giving continuous infusions. B. Emptying the bladder. C. Measuring the patient's temperature. D. Connecting a ventilator. Answer: A. Drawing blood samples or giving continuous infusions. Explanation: These ports allow the clinical team to draw labs, like ACT or ABGs, and administer medications directly into the high-flow circuit. In VA ECMO, why is the right radial artery the preferred site for arterial blood gas (ABG) monitoring? A. It is the easiest to access. B. It reflects the oxygenation of the blood going to the brain, pre-mixing point. C. It reflects the oxygenation of the ECMO pump. D. It prevents Harlequin syndrome. Answer: B. It reflects the oxygenation of the blood going to the brain, pre-mixing point. Explanation: in peripheral VA ECMO, the right radial artery provides the best estimation of the oxygen content being delivered to the brain and heart, especially if the native lungs are failing. Which medication is the antidote if a patient on ECMO has an overexposure to heparin causing major bleeding? A. Vitamin K. B. Protamine sulfate. C. Aspirin. D. Warfarin. Answer: B. Protamine sulfate. Explanation: protamine is the standard reversal agent for heparin, though it must be used cautiously in ECMO patients as it can cause rapid clotting of the entire artificial circuit.